Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Welcome. Do you want to avoid surgery? Are you suffering with joint or muscle pain? Do you have arthritis, dull aches, or stiff joints and can't figure out why? Do you feel like you're slowing down and can't walk, run, or play sports the way you used to? Welcome to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and I'm asking you to stay with us while Dr. Darrow answers these questions and so much more today when you call the program at 866-870-5752. We are a resource for information and education about the orthopedic musculoskeletal system of the body. If you call now, you'll get a free copy of Dr. Darrow's latest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That number again is 866-870-5752. And let's welcome Dr. Darrow. Hi there.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up. You know that.
I know. I'm excited. Well, we could be an example to all our listeners to live it up too, because we want people to be pain-free, right?
Well, that's the name of the game. That's what I've been doing my entire medical career. And I was very lucky to discover what we call regenerative medicine, which has progressed through the years. In the old days, we used to use things that would irritate the body, like concentrated dextrose, that's sugar water. It doesn't sound like much, but it does some stimulation of tissue growth. Sodium moruate, which used to burn quite a bit, but it worked. Zinc sulfate, same thing, it would burn wherever we injected it, but it would work to stimulate tissue growth by drawing fibroblasts to the area, which are cells that produce collagen, which is a major constituent in cartilage. So, you know, I hear it all the time from my patients. Their orthopedic surgeon said it's impossible to grow cartilage. But as much as I love the orthopedic surgeons, they're not reading the articles in their own journals, because we've known that cartilage can be regrown for many, 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 many years. And back when I was in medical school, I used to talk about it. And my professors would say, if you don't shut up, Dr. Darrow, we're going to throw you out.
Ooh.
Because, yeah, I had a big mouth about natural medicine. Even before I went to medical school, I was always interested in natural medicine. And, you know, the first law of medicine is do no harm. So if you're going to do something, do the most conservative thing possible. You know, stay away from knives and medications if you can help it. So when I say knives, I'm talking about scalpels. There are times when it's needed, obviously. There are times when medication is needed. If you've got hypertension and there's a possibility of having a stroke, you better be on some medicine to lower your blood pressure. But there's other ways to do it too. You know, you can always lose some weight and get that pressure off of the system so you're not pumping out adrenaline all the time. And there's just a lot of ways to heal that have nothing to do with what we consider to be modern medicine. And unfortunately, modern medicine is driven by the dollar bill. Everybody knows that. The complex, we'll call it the medical industrial complex, is very rampant. We all know what's going on today, and most people listening to the show are not happy with what's going on today. And they're not happy with their insurance companies that don't pay for things that they need. And, well, it's just the way life is. You know, we're not supposed to be happy all the time, but you can take care of your health. You can take control of it. You've got the internet. There's a lot of information out there. You've got Suzanne Somers' books, which I think are one of the greatest tools for learning about natural medicine. The book I'm holding in my hand right now that people watching the video can see is Suzanne Somers' new book, A New Way to Age. And She was very nice to me. We've been friends. I've been treating her for, gosh, I don't know how many years, 20 years or so. And her family, all of her family coming to see me. And she wrote a chapter in this book on page 302. It's about, I don't know how long, 16, 20 pages about regenerative medicine. So I'm all gung-ho with regenerative medicine. It's worked all over my body. I self-inject whenever I have an injury, and I've been very lucky and had these healings work. I also have a book that I've written called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And this is a great primer for all of you who want to learn about how to heal your orthopedic injuries. That can be neck pain, back pain, arthritis, all the joints. And those of you ready for a surgery, I recommend before you do an orthopedic surgery, unless it's an emergency, that you talk to someone who does this type of work in regenerative medicine of regrowing your tissue. Why are you going to cut tissue out? That makes no sense. It's a new analogy I've been using for the last month or so. If you're going to fix a house, you don't cut the foundation out of the house. And that's unfortunately, what most surgeries do for the joints, ligaments, and tendons. They cut out tissue. And why you want to cut out tissue, and then you have a long-term arthritis. You get an immediate arthritis after these surgeries. And I'm not here to fight with orthopedic surgeons. They've got a great big culture behind them. I was in training to do orthopedic surgery. Those of you that listen to my show know this. And I was really gung-ho. I followed the culture of orthopedic surgery, which is surgery fixes everything. Mm-hmm. And I learned because I literally begged my professor, my boss, who was training me, to do a shoulder surgery. And those of you that know me know that surgery not only failed, but it destroyed my shoulder. It blew up like a balloon all the way down my arm. And I had a high fever. And that shoulder did not heal until a few years later. I was miserable. And the healing didn't take place on its own. It took place because I experimented on my shoulder by injecting regenerative medicine in my shoulder. And it was the greatest awakening of my medical career. I woke up the next morning completely pain-free with full range of motion. And that shoulder was perfect for 12 years until I re-injured it again. I am a very, I don't know what you call it. I guess the word is crazy athlete. I'm very repetitive and I do things hard. And I re-injured the shoulder the first time after the injury that I first had, which was augmented terribly by a surgery that went wrong. It wasn't the doctor that did it wrong. The orthopedic surgery was the best. But it's just that surgery doesn't work out too well for most people. I'm sorry to tell you that. And a lot of people get a surgery and they go, ha, it worked. And then they come back like 2 years later and go, gosh, it's worse now than it ever was. So I admonish you, if you're going to think about surgery, to think about regenerative medicine first. It's conservative. All it is taking cells from your body. We get platelets from your blood. We get platelets and stem cells from your bone marrow. And we can do either treatment depending what you want to do, depending on the intensity of what your injury or arthritis is. And most of my people are happy with me. Not everybody. I can't fix everybody. I've got to be really certain to pick the right patients for a lot of different reasons. Trish, I don't want to keep you waiting, so we're going to go to you about your thumb joint. This is Dr. Marc Darrow. And how long has your thumb been bothering you, Trish?
Well, it's actually both of them, but the left one is worse. It's been several years. I've had the kind of steroid injections. Is that what you call them?
Yes. Yes.
For, a number of times, and they help for, 6 months or so, and then I'm back to where I started from.
Yes.
So this is the CMC joint.
Yep.
It's I have no cartilage left.
Yes. Can you move your thumb?
Oh yeah, I have reasonably good range of motion.
Okay.
It's just painful, especially pinch strength is kind of lousy.
Sure.
And doesn't bother me all the time, but enough that I've been to an orthopedic surgeon who looked at my x-rays and so on. I have some bone spurs going on there and arthritis and just no space left because there's no cartilage there. So
okay. Did he suggest that you have surgery or no?
Oh, yeah. Yeah, I mentioned to him about, the possibility. I just thought, well, I'll just ask him his opinion about getting stem cells or this or that, and he calls it voodoo medicine.
Of course.
Yeah.
Guess what I call surgery?
I don't know, last resort or don't ever do it.
No, it's not a last resort. It's a terrible resort. I call it voodoo medicine.
Yeah, well, you guys it'd be interesting to have a discussion, the two of you, right?
Well, I have I have a lot of friends who are orthopedic surgeons, okay? And when we discuss what I do, they go, it's voodoo medicine. And I tell them what you do is voodoo medicine because I get all the people that you made worse. And then we heal them. So, you got to think of it like this. They're different. We're in different religions, okay? I'm in the religion that's conservative, and they're in the religion that is not conservative in the terms of they hurt people quite a bit. I'm sorry, they don't mean to. And they're great people, and they're great doctors. And to be honest with you, orthopedic surgery is one of the most difficult professions in medicine. Mm-hmm. They're amazing doctors. They only take the cream of the crop these days. Back in the old days, they were the bottom of their class. They were the big jocks, the football players and stuff. But today, well, it changed because now it's the big money. Orthopedic surgery is the big money in medicine, in orthopedic medicine.
Well, I noticed they have a lot of attitude.
Yes, they do.
Surgeons generally sort of, maybe they migrate toward the profession because they have sort of ego or something.
I don't know what it is, but look, I've done a lot of surgery myself in my training with a lot of different orthopedic surgeons. Anytime I had an opportunity, I used to call every surgeon in town when I was in training, in medical school and residency. And I go, can I come into surgery with you? And they go, sure, come on in. So I know a lot of them. Yeah. And, we do work hand in hand even now. When I get someone that has something that I think is iffy and may need surgery, I send it to an orthopedic surgeon. Guess what I hear every single time? We got to rush them into surgery. They need surgery. And then the patient goes, Doc, Mark, I don't want surgery. What do we do? And we use regenerative medicine of platelets and or stem cells. And most of those people that, quote, needed a surgery didn't need a surgery and they're better now. Okay? That's not every case. Some people do need surgery. If you have a broken bone and it's sticking out of your leg, you better get right to the surgeon. But for things like your thumb, and I'm going to talk about your thumb right now because so many people I treat with this thing, arthritis of the fingers, and the basal joint of the thumb, your CMC, what people call the saddle joint, is so common. And, it's basically an overuse. It's basically an overuse injury. It wears down. And I want to tell you this. Your surgeon looked at your X-ray, I guess, and said you have no cartilage. But you just told me your thumb moves. That means you have cartilage. You may not have as much as you had when you were 15 years old, but you have enough sliding surface to move your joint. Okay? Okay. So I hear it all day long. Every new patient comes in and goes, I've got bone on bone. I need to have a joint replacement. They're going to amputate my hip or my knee or my ankle and put in a fake joint. And I go, You don't have bone on bone. Look at yourself. You're walking. You're moving. Okay?
Okay.
So I understand you have pain, yeah, but that doesn't mean you need a surgery. And it certainly doesn't mean it's, quote, bone on bone. I use this analogy all the time with my patients. If you've ever tried to rub two bricks together, they don't move. And that's what bone is like. If it is bone on bone, that joint is not moving. But you can have something else, like let's say the shoulder has what we call adhesive capsulitis or a frozen shoulder. Okay, it doesn't move at all. That doesn't mean you have any arthritis at all. That can happen to anybody where the shoulder freezes up because of adhesive capsulitis. That just means that the capsule around the shoulder tightens up because you've had some pain in the shoulder and you do not move your arm for a while, and then it tightens up more. those are usually pretty easy to fix. Okay? You don't have to get what we call a manipulation under anesthesia. Okay?
Okay.
And manipulation under anesthesia, if you look it up, has very poor results. What they do is they put people under an anesthetic, a general anesthetic, and then they rip the shoulder loose. They literally tear the tissue. And some people come out fine, but most people that I have seen, it comes out poorly. They may be okay for a while, and then it comes back worse. And that's another thing. You had a steroid injection in that joint, in your thumb joints, and you said it worked for a while. Well, that cortisone, any steroid, O-N-E at the end of a medicine means steroid, okay? It disintegrates that cartilage.
Ugh. Okay.
I'm not saying one time will do it, but I've had people that have had so many steroid shots that they really do become bone on bone. It destroys the joint. It destroys the tendons, the ligaments, wherever that's put. And I've seen terrible cases where I've had to do so much regenerative medicine using their platelets or stem cells to rebuild whatever that is. But they get better. So I don't feel any dire straits about your thumbs. I think you're in good shape. You just need, if you want to.
I tried PRP. I actually tried PRP.
Okay.
With a doctor over in the Montrose area of LA. Yeah. And had a number of injections like that, and I just found they didn't really help. I mean, I don't know how long.
So let me talk about that. There's several reasons for regenerative medicine to fail. Okay.
Okay.
I go through them every show because this is so important. People have to follow the doctor's orders in order for things to work.
Right.
So let's say you had a surgery on your knee. You don't go running a marathon the next day. All right?
Right. Sure.
People know that because it's a surgery. But when we do PRP or stem cells, people don't have the after effects of a surgery, and sometimes they feel fine. I just did my wife's knee on Friday. Okay? She's got some fluid in the knee. She hikes like crazy. She rides a Peloton. She's a pretty great athlete, okay? And after I treated her, I said, "Is your knee stiff?" She goes, "Yeah, a little bit, but not a big deal." So I said, "Are you going to rest?" And she goes, "Well, for a couple of days." I go, "That's not the way to heal your knee." Okay?
Okay.
And the other thing, so activity is the number one reason people fail these procedures. Number two, they take anti-inflammatory medication, which blocks the regeneration of tissue that we are creating. Okay? So every time somebody pops an ibuprofen for knee pain or shoulder pain or whatever it is, they are blocking the body's natural mechanism to regrow that tissue. Okay?
Okay.
Another reason is a lot of doctors don't use an ultrasound. You don't need an ultrasound for a teeny joint like the thumb joint. But for the knees, the shoulders, and the hips, as an example, you absolutely have to use an ultrasound or you're going to miss the joint most of the time. That's been studied. Okay?
I think
so. Those are doctors that are. Those are doctors that are. What's a good word for them? They're dinosaurs. They go, "I don't need an ultrasound. I've been doing this 50 years." Well, get with it, guys. There's new technology that can help you do better for your patients. Spend the money. I've got 3 ultrasounds in my office. I run them from room to room. Okay? I didn't want to do that. I didn't want to make the investment. They're real expensive. I've taken training. I've done probably 100 hours of training on ultrasound. I do it every year. Why? Because it helps my patients. Do I like taking time off from my life to go fly away somewhere and spend a few days, indoors in a cadaver lab? No, I hate it. I'll be honest. I don't like it. But I do it because it's the only way I'm going to keep learning. Okay? So another reason for failure is you get a bad doc. What's a bad doc? A guy who doesn't know what he's doing. All right? Many people are doing regenerative medicine of platelets and stem cells. They have no clue what they are doing. Like anybody else, when you go to a doctor, you want to find out, how much do you do every day of your life? That's a big question you ask. How many thumbs did you do today? That's what you ask your doctor in Montrose. Mm-hmm. Okay? And then, well, another big one, Trish, one last thing I'll say and then you can talk, is getting enough treatment. This is not a magical cure. Don't think when you have a doctor who does regenerative medicine of platelets and stem cells that you're going to a magician. It's not. It just makes sense. Every time you inject, you're going to grow a little bit of tissue. Sometimes one treatment is great. Sometimes it takes a lot of treatments. Okay?
Right.
We never know ahead of time. So there's all these variables that go into which doctor you choose, how it's done. Everybody does these procedures differently, just like everything in medicine.
Okay.
That's why it's called the practice of medicine. So you were gonna say something or ask something, so go ahead.
Well, yeah. I mean, how do you deal with the bone spurs? I mean, theoretically, this arthritic joint has a bunch of stalactites on it or something, you know?
Yeah.
I mean, there's actually, you know, if you're just going to inject something, that doesn't solve that problem.
It can solve that problem. Yes, it can.
Oh, okay.
I'm not saying it will, but it can. I've seen huge bone spurs disappear. And with a little joint like that, what can be done is the needle can be used, a little teeny needle like a 30 gauge. It's like an acupuncture needle, it's teeny. Can be used to shave off little bits of the bone that's grown if it's in the way. But most bone spurs are not the cause of the pain. They are the result of the joint being loose, okay? And when a joint is loose, the bone overgrows to try to stabilize the joint.
Oh, okay.
It's called piezoelectric forces. You can look that up. Piezo forces. They're electrical forces that the bone, the calcium, deposits along. So as an example, you see this in other countries more than in America if you've ever gone to third world countries. They don't really take care of people very well. So let's say a leg is fractured on a little kid. They don't even necessarily set it. They don't have the surgical tools to repair it. And the kid grows up, and very often over the years that bone, which was crooked, because the fracture healed, but it didn't heal in a straight line, it healed crooked.
Okay.
Over the years, that bone can actually regenerate down the gravitational lines, the piezoelectric forces, and the bone that is sideways will be eaten away, and the bone, the way it should have grown, starts to regrow.
Oh my God, that's amazing.
So everybody with spurs does not have pain, okay?
Okay.
They just have loose tendons, ligaments, joints, things like that.
Right.
So I'm not telling you because you've got bone spurs that you're having that pain you're having. That's a result of those thumbs being used too much. I don't know what activities you've done, but I get that with a lot of postal workers, people flipping envelopes all day, guitar and banjo players, you name it. There's a lot of overuse. Guys who work with their hands, very common. We'll see that type of arthritis, but it doesn't stop them from healing.
Right. Okay. Well, I appreciate that. I have spoken with a doctor in Arizona as well who not only does the stem cell injections, but goes in arthroscopically, and
you don't need to go in arthroscopically. Arthroscopic means camera. Hang with us. I want to go over this. It's real important.
Okay. Excuse me. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.